Hello, my name is Scott Richardson and I'm a doctor of acupuncture and oriental medicine. You know, a lot of my athletes and patients that are coming to me have never had acupuncture or needling services before and they don't know what to expect. And so I wanted to take a second to explain what it's like for your first visit. Now, first of all, if you haven't already done so, we do have online scheduling for your convenience, and when you schedule an appointment online, you'll receive a confirmation email that will allow you to fill out your paperwork before you come in. That will give me as a provider an opportunity to look over what's going on, and then also that makes so that you don't have to sit in our waiting room and fill out the paperwork there. Now, when you come in, we will take a minute to discuss what's going on, a little bit about your medical history, and then we'll do any examinations that we need to. A lot of times with acute injuries or sports injuries, we'll have to go through range of motion, but I'll always sit down, talk with you with what's going on, and then what your goals are for the treatment. I will explain everything that I do before the treatment, and make sure that it's something that you're comfortable with and something that you want to continue to do. Then when we're actually doing the treatment, that's going to depend on what type of service that you have selected. Something like acupuncture, we will have you lying on a table, we will place the needles, and then you'll be resting on the table for about 25 to 30 minutes. Sometimes we're using infrared therapy. We may include cupping or other modalities in with it. For people that either don't have that much time, I have some people that just don't like lying still for that long. We also offer dry needling services. Exact same needles as in the acupuncture, but this is something that is kind of an expedited treatment. Usually 15 to 20 minutes long. You come in, we have that same intake at the beginning, and then we will perform an acupuncture or dry needling style treatment where it's very quick. We get the muscle to release, to let go. Generally, I'll do some range of motion after we do the dry needling, and then we can also add in cupping or sports taping. I use rock tape or kinesio tape to support the treatment that we've done. It's important to know that the treatments rarely are uncomfortable. People think about acupuncture and dry needling as something where you're getting poked with the needle over and over again. They assume that's something like getting a shot, and usually that's not the case. Most of the time people are very comfortable, relaxing. They find that it actually feels good, and many times we see improvement with that first treatment, especially with a dry needling. We're going to check your range of motion before the treatment. We will recheck it at the end, make sure that the pain level's gone down, as well as that you're feeling better and that you feel like there's some progress. Sometimes it will take up to 24-36 hours to see improvement, and so if we're not seeing something immediately, then I'll have the person again wait for that period of time. Sometimes the next day is when they notice the full benefit of the treatment. Another question that I get all the time is, what should I wear? I will generally tell people wear loose, comfortable clothing. Shorts and t-shirt is great. Yoga attire is also very good. Sometimes we'll have to roll the sleeves up to the elbows or the pants up to the knees, so wearing something that allows for that is also helpful. Another question people will have as far as the injection therapy, what is injected. There are specific substances that we can inject. There are specific substances we cannot inject. If you have questions, you can feel free to email me and I can answer any questions that you have. Generally though, we're using natural products such as vitamins and minerals. I do a number of B12 shots. Sometimes we can add a numbing agent like lidocaine or Procaine to the treatment, and that just kind of makes it more tolerable, or that it's more comfortable. Again, as I've mentioned in some of my other videos, we are doing an AcuProlo style treatment, a prolotherapy, where we can use dextrose, and I will combine that with, again, a lidocaine, usually some B vitamins as well. And then we're always adding more treatments and modalities as I get trained in them. And so if you have other questions, again, feel free to ask. If there's something that I haven't covered or you have additional questions, I would encourage you to reach out. You can email me through the website and I'll be happy to answer any other questions that you have. Thank you very much.